being a small town doctor when COVID hit. At that time, Dr. Charles Hoff was a doctor in Lytton, BC, and he'd been working there since 1993 doing family and emergency medicine. In January of 2021, the rollout of the COVID vaccine program started in Lytton and began with 900 First Nations people. They were using the Moderna vaccine. Now, Dr. Hoff says he was a little bit aware that the new RNA DNA therapy had never been used on humans. It had bypassed any animal trials and no long-term safety data was available. And it was therefore not approved or licensed by Health Canada or the FDA. And he was concerned it was simply being pushed in its experimental form under the emergency authorization because of the pandemic. So he told his colleagues in medicine that he didn't want to participate in the vaccine rollout since it had no safety evidence. Well, shortly after that, he went away on a vacation. And 6 weeks later, when he came back, he started to see some very serious side effects in his patients who had had their first dose of Moderna a few weeks before. It was around this time that 12 countries in Europe shut down the AstraZeneca vaccine because of life-threatening blood clots. But Canada continued to administer it. So Dr. Hoff sent an email to a group of local healthcare providers who were involved in the rollout, trying to alert them to the serious safety signal from Europe and suggesting that maybe they should pause what they were doing to see what the risk of harm was. 3 days later, he got a verbal reprimand for his troubles from his superiors at Ontario Health, and he was told that he was putting people at risk by creating vaccine hesitancy. He was told that this would be reported to the College of Physicians and Surgeons of BC and that he was forbidden to say anything negative about the vaccine while he was at work, and to direct any concerns that he had to the medical health officer in charge of the vaccine rollout. So he sent an open letter to the provincial health officer, Dr. Bonnie Henry, asking the same questions, telling her there had been no infections or deaths from COVID up in Lytton, and that to him, it looked like the vaccine was more dangerous than COVID itself. Well, both of those letters were immediately sent to the college, who opened an investigation against him, all for the crime of causing vaccine hesitancy. And Bonnie Henry did not respond to his letter, but referred the matter to a vaccine safety specialist who disregarded all of the vaccine injuries as coincidences, even though all of the new problems had begun within 72 hours of the COVID injection. So 3 weeks after telling a patient with proven natural immunity to COVID that she did not need a COVID vaccination, Dr. Hoff was fired by Ontario Health and was not allowed to work in the emergency room any longer. Dr. Hoff was also saying that there is extensive evidence